Hey, we're back with another edition of Farm to Table, explaining our clinical reasoning, our thinking around restoring position for our athletes. Coach Di, willing victim, on your back, Di. So one of the things that we obsess about is rotation of the tissue, right? Specifically, in this situation, since we're talking about the femur, we have to have normal, some rotation. So depending on who you talk to, what we can say is externally, we want somewhere around 45 degrees. That's pretty reasonable. Nice job, Di, that looks good. And internally, we want somewhere between 30 and 45 degrees. Ultimately, I want a rotation window of 70 to 90 degrees. We like 45 and 45, but I'll take some. When we bring that femur straight up, I want to see some internal rotation of this leg, and ultimately, so that the leg doesn't have to spin up and become all proud to solve this problem. If I was assessing her, I would actually be weight bearing through the femur and then looking what her rotation looks like. And you can see it feels a little stiffer when I actually get that joint in some approximation, right? It's a little more loose when it's up top because there's more slack. We're spinning that slack by sort of giving up some of that sort of relationship between head of the femur and the acetabulum. So one of the things that we do then in order to restore that is classically we use a little distraction. So I'm a Maitland trained therapist. That meant that I'd be like, Diane, I'm gonna put my hands inside your groin here, and I'm going to try to get some distraction into this. So I would try to gap and distract, but this leaves me into some weird positions with some of my good friends. Say, I'm gonna put my hands in your crotch, okay? So Brian Mulligan comes along, and then all of a sudden, we see all these wonderful banded distractions. And suddenly you're like, Brian Mulligan knew what was up. New Zealand physio, I can get that all the way down. I get myself comfortably strapped. And what's nice about this is I can get into all of these complex positions where I can load up the hip, just do what I need to do if she's appropriate, add the rotation and all these combined motions. So I can approximate, distract, rotate. I can prioritize rotation first, then distraction, then approximate. And it allows me to come in and solve some really interesting problems with my hips. So this is one of the ways that we're trying to restore function of flexion and in rotation. But it also makes the athlete feel less pinchy because you've got this little distraction force. Well, that's great. You happen to be good friends with a physio, but a lot of us don't have one in our back pockets. So guess what we came up with? A long time ago, as a young student, it bugged me that I needed someone else to give me that. So I was like, there's gotta be some way I can do it. Well, I was reading Louis Simmons' book, right, about powerlifting, the book of methods, and I was like, I wonder if I could use a band to create some distraction at the hip. So Diane steps into the band, and this was the Hip Capsule Mob born. So she's gonna kneel on that, and all of a sudden, we can either have the band going posteriorly, go on hands and knees. Band can go posteriorly. She can back this into flexion, right? And work on, keep your weight all the way going through the femur here. Kick this leg like this. And then she can work on some rotation, pushing in. So what's key here is that Diane now, it can work on putting her leg into a position of emphasis, adding the motion. Because she's weight bearing, it's like me coming through the femur this way. But what we see is, go ahead and rotate 90 degrees. Keep going, keep going, keep going. Now we have a little lateral distraction. So the band is pulling out from the side. And then Diane can work on placing her leg into internal rotation or external rotation, go the other direction, to work on that position. But the key here is that she doesn't just collapse, her line of force goes through the femur, and then this allows her to noodle and find the ray, vector, and corner. So she rotates a little bit further, rotate, you bring that leg with you. Now we have even more lateral distraction, still makes sense from an arthromechanics point of view. We're just buying a little bit of space in the capsule, and then she feels like suddenly she can access that. So this key here is that she can bias the lower leg to get the rotation that we're after. We still be weight bearing in the femur, and we can restore that motion. And the retest is off the hook. Look, is it 95% as effective? 90%? I'll take 80% because my athlete can now do it to herself should she decide that she needs, hip range of motion, or we can work on isometrics here. We can build resistance here. She can use her other leg and move through range. There's so many permutations of putting our athletes into positions and getting them to work. Traditionally, right now, we're seeing most athletes work on their internal rotation predominantly in some of these 90-90 positions, which are great, but not really approximating. Hip is doing a lot of things, and you'll notice I don't really have any hip flexion going on here. Hip flexion in this position, what I'm really doing is just abducting the hip, which is not the same thing as working on the hip closer to midline. So in this flexion position, I would need to be way back down here to be working on my internal rotation. And once again, I still am not weight bearing through the joint. So all things are good. 90-90 is easy to deploy. But the Hip Capsule Mob is one of our first interventions about restoring normal relationships between femur and pelvis. And that's how we got from the table to the gym. See you next time.